Good evening to everyone. Good evening, Arun, Saloni, Taba brother. Happy to see you all back. And today, again, we are here with another couple of videos to get a deeper insight into another few set of topics. Uh, we discussed about anterior abdominal wall and posterior abdominal wall in detail last week, and there is a topic called as lumbar plexus, which is very important for you guys, and our dear Meera ma'am has taken it as a separate dissection segment for you. So I think we'll start off with that particular topic today. So before I start, let me welcome Dr. Meera.
Good evening, Dr. Aishwarya.
Good evening, ma'am. How are you?
I'm fine.
All good?
All good, all good. How are our students? Good evening, all. Good evening, students.
Students, are you able to? Yes, they are.
Yes.
Yes. Okay. Okay. Are you all excited to learn this way? Like, I can see a lot of people coming back to the session. Yes. Arun is really excited. Arun is like, there before even any one of us are here. Okay, great. Great to see you guys again. So we will start off with lumbar plexus. So, ma'am, can I share the first video?
Yes, yes, yes.
Discussions and all those things. Okay, so I request my technical host to play the first video of the day, uh, lumbar plexus.
Hello students. Now, after we know the muscles and all other structures of the posterior abdominal wall, now we'll just have a look into the nerves. What are the nerves of the posterior abdominal wall called as? Put together what it will be called? It will be called as lumbar plexus. You might have heard of brachial plexus, you might have heard of sacral plexus. So in the abdomen, in the posterior abdominal wall, we have a bunch of nerves. Everything will be a branch of lumbar plexus. So what is important here? How to locate the lumbar plexus in dissection? So this muscle, we have already identified. Can you tell me which is this muscle now here? This muscle? This is psoas major. The psoas major muscle, beneath the psoas major, we have the lumbar plexus formed. It's a very important point. So where is the formation of lumbar plexus? The lumbar plexus is formed below the substance of psoas major. I hope you can remember. So this is the psoas major. The first point, very, very important, where exactly you can get all the nerves together, that will be behind the psoas major muscle. Now this lumbar plexus has got many branches, and we'll try to identify the branches of lumbar plexus. I told you psoas major is a landmark for us to identify the branches. So there are nerves coming along the lateral border of the psoas major. There are nerves coming above the psoas major, and there are nerves coming medial to the psoas major. So we'll divide the branches into three categories. The branches coming laterally, the branches coming on the psoas major, and the branches coming medial to the psoas major. So the formation of lumbar plexus is below the psoas major muscle, and the nerves, the branches are emerging out either lateral to the psoas major, medial to the psoas major, or on the psoas major. Now, lateral to the psoas major, which are the nerves? So, any idea which is this thickest nerve, what you are seeing here? This is the identification. This is the thickest branch of lumbar plexus, what I am holding now. This is the thickest branch, and this is called as, anybody? Femoral nerve. This is the femoral nerve. So it emerges from the lateral border of the psoas major muscle, and among all the branches, this is the thickest nerve. So the first nerve of the lumbar plexus that emerges lateral to the psoas major is called femoral nerve. Now, the second nerve, just above the femoral nerve, you can see one nerve here. It is crossing the iliacus muscle. This is the iliacus muscle. It is crossing the iliacus muscle. So this is very important for us for the identification. This is lateral cutaneous nerve of the thigh. So how to identify it when we have a specimen or on a patient, how to get these nerves? Femoral nerve. How will we identify femoral nerve? So this femoral nerve will be between the psoas major muscle and iliacus muscle. Now, how to identify the lateral cutaneous nerve of the thigh? It is between, or it is crossing the iliacus muscle. So, two nerves I have told you now. One is between the psoas major and iliacus, and that is the thickest nerve called as the femoral nerve. Now, there is a nerve which crosses the iliacus muscle, that should be lateral cutaneous nerve of the thigh. Now, we are going above the iliac crest. This is the iliac crest. We are going above that. So, to see the nerve, I will have to lift the kidney like this. Now, you can see here, we can make out there are some nerves here. One thin nerve here. This is ilioinguinal nerve, the third branch of the lumbar plexus, ilioinguinal nerve. Just above that, the next branch of it is called iliohypogastric nerve. So, this is the thicker one compared to the ilioinguinal nerve. So, we have 4 branches of lumbar plexus that are emerging from the lateral border of psoas major muscle. So, this will be femoral nerve. The nerve crossing the iliacus will be lateral cutaneous nerve of the thigh. Just above the iliac crest, I see 2 nerves. The above one is the iliohypogastric. Just below that is the ilioinguinal nerve. So, there are 4 nerves which emerge along the lateral border of psoas major. Now, on the psoas major, above the psoas major, you can see here a nerve that runs above the psoas major is called genitofemoral nerve. When it runs down, it will divide into a genital branch and a femoral branch. So, this is the genitofemoral nerve, and it is running on the psoas major. So, the identification of this nerve is it runs above the psoas major. Now, we go medially, this side, medial to the psoas major. I will pick one nerve. Any guesses on this nerve? Medially, this nerve is called obturator nerve. So, medial to the psoas major, this nerve what you see is the obturator nerve. So, you know that, very important. Once we identify the psoas major, all the branches of the lumbar plexus are very easy for us to identify because they are located either laterally or on the psoas major or medially. So, which are the branches on the lateral side? So, lateral to the psoas major, the thickest nerve we can see, we start from below upwards. So, thickest nerve below is femoral nerve. Just above that is the lateral cutaneous nerve of the thigh. What is the identification? It will cross the iliacus muscle. How to identify femoral nerve? It is between psoas major and iliacus. Now, coming above, you have to identify the iliac crest, which is a bony landmark. Go above that, we see 2 nerves, ilioinguinal and iliohypogastric. So, ilioinguinal will be the thin nerve, iliohypogastric will be the thick nerve. So, these are the 4 nerves, they come out along the lateral margin. Now, on the psoas major, there is a nerve running called genitofemoral nerve. And medially, we see one nerve here. I will pick this up. Medially, we have the obturator nerve. So, this is about the lumbar plexus.
Thank you for giving us a video which has no technical interruptions. Thank you so much for that. And I think it was one of difficult topics for me when I was in first year. Something which I never liked to study was plexus. And I had a tough time clearing brachial plexus because that was one of the most important questions. Okay, now I think I'll move on to our dear students. They are also having a lot of doubts, I think. Students, it's a little tricky topic. You will have to, first, actually, it's better that you learn the theory of this topic, I feel, right, ma'am?
Yes, yes.
One, each branches, how the each of them are forming, the plexus as it is forming, and then how each branches comes out and how each branches go down, descent, and supply the lower limb. So once they find the theory, make it understood, and then they come and watch this, it's going to be a icing on the cake, I feel. Okay, I'll move on to my students. Over to you guys for your doubts. discussions. And if you want us to play the video again, also we can do it in case it was a little tricky topic for you. We can do that. That's not a problem.
So students, some points which you should remember here is that first point, I'll come to your question, Arun. So first thing is that where does the lumbar plexus supply? So lumbar plexus is going to supply the muscle and skin of the lower limb. That is the first point you should remember. So what is the purpose of forming such a plexus? Where does it supply? That will be your doubt. Even though it is in abdomen, it is going to supply the thigh region. That is anterior compartment, the medial compartment of the thigh. So main function of lumbar plexus is to supply the thigh region. Okay. And the root value. The lumbar plexus is formed by lumbar nerves, that is ventral rami of L1, L2, L3 and L4. It receives contribution from T12 also, the 12th thoracic spinal nerve. Is that clear? So first point, lumbar plexus will supply the thigh. Second point, the root value of the lumbar plexus is L1 to L4 with a minor contribution from T12. Then coming to the branches, which are all the branches we have explained or seen in that video. Anything else? Any doubts?
Arun and Pavan, is your doubts cleared, understood? Can you please revert to the... Okay, okay. Ma'am, can I ask them a question? Do you mind me asking a question?
No. We have to. It should be interactive. See, the thing is that they have to read this topic. So we'll help them how to read it by asking questions.
Yes. So before I ask my question, I think Pavan, root values for all the nerves. He's asking the root values
Root values?
for all the nerves in lumbar plexus.
Yeah, okay. So first thing, I told you that there is a contribution from 12th thoracic nerve. So the 12th thoracic spinal nerve will join with L1 and they will form the first nerve, that was iliohypogastric nerve. So iliohypogastric nerve will have from T12 and L1. Then next nerve was ilioinguinal nerve, which has got only L1, contribution from root of L1. So the first nerve, we are talking about all the nerves which are on the lateral side of the psoas major. First one was iliohypogastric nerve, the thicker one, which has got a root value of T12 and L1. Second one, ilioinguinal nerve, which has got a root value of L1 only. Then we have something called genitofemoral nerve, which has got L1 and L2. L1 and L2. And lateral cutaneous nerve of the thigh will have L2 and L3. So one below the other we are going. So it's very easy to remember. Start from T12. T12 and L1 will form the first nerve, iliohypogastric nerve. Only L1 will form ilioinguinal nerve. L1 and L2 will form the genitofemoral nerve. Then L2 and L3 will form the which nerve is that? Lateral cutaneous nerve of the thigh. Okay. Then we have two nerves with the same root value, that is L2, L3 and L4. So from posterior part of L2, L3, L4, we have the femoral nerve, and from the anterior part of L2, L3, L4, we have the obturator nerve. So this is purely the theory part of it. So do you want me to draw and show or anything like that? Is the root values clear? Is the root value clear? Pavan?
May I interrupt here, ma'am? If
Yes.
it's students, I hope a proper timetable is shared, a schedule is shared with all of you, right? Sure, Pavan, we'll get back to it, but can you just revert if any? Yes. So in that schedule, no. Okay, there are students who have not yet received it. Okay. So we are following this study marathon on the basis of a schedule. A proper schedule is formed by from Dr. Polaris side. So every day. Okay. Understood. So what we will do is, I'll just listen to me for a minute. Every day you will be given 2 topics to learn. Okay. See, for example, this Monday. So now we are on Wednesday. The last 2 days before, that is on Monday, you were supposed to learn 2 topics. one from anatomy, and if I'm not wrong, it is one is from biochemistry. Okay, so two topics you had to learn. One is lumbar plexus. So every day, the pre-recorded videos will be available for you guys. You can just go to Dr. Polaris app and see the pre-recorded videos. See, why I am telling you is Dr. Tejaswi, sir has taken an amazing class, a detailed class on lumbar plexus. If you just take a moment to watch it in at least in 2x and then come back and listen to ma'am's practical, it's like, you know, you're tired enough to go for your exams. It's that is how it's going to be. Because today also I listened to the video just before coming to the session. Every time when I come for the session, I also revise in case I can also, you know, contribute something, or I also learn something. I also revise with sir's class and ma'am's classes. So today also I saw the class. It is such an amazing class. Just take a look at the lumbar plexus video in Dr. Polaris app. Okay. Okay, don't worry. Since most of you are not aware of the plans and all those things, don't worry. There will be a point of contact whom you are in contact with, right? There will be someone whom you are contacting with, who is sending you the details of this event or this activity is happening Wednesday 6:30 or Monday 6:30. So just talk to that person, find out what is the timetable and the plans and all details. They will definitely help you. Please, a mail was actually sent to you when you register to this event. If you just go back and check your mails also, you will get an idea about how this is going to happen. So everybody who is not aware of this, please go back to your POC and just ask them. They will definitely help you guys out of it. Okay, so in this week, there are a couple of topics which is scheduled, which is actually listed in the schedule. Go through it one by one. See, just 2 topics you have in a day. That too, pre-recorded videos are already there. You just have to listen to the videos, come back and listen to ma'am's practical sessions. That's all. So don't worry. We will make it a little slow for you guys so that you can also catch up with us in the practicals. Isn't it right, ma'am? Because lumbar plexus and all is something which will take at least 2 to 3 days to register.
Yes, yes. So actually, they should remember some main key points related to that. So if they have to remember that, first point is where exactly it is formed. So where exactly the lumbar plexus is formed? Anybody? Which muscle is it related to? Yes, beneath the psoas major. Correct. So the first point, you have got it right. So lumbar plexus is formed beneath the psoas major. Now, which are the roots taking part in formation of lumbar plexus? Which are the roots? Which lumbar nerves are taking part? Can anybody answer?
That is an important question because tomorrow you have a recall session, and in recall session also one of the questions is this.
Yes, L1 to L4, very correct, with a small contribution from T12. So you have got that second point also right. Now then we have the branches. So which are the branches emerging from the lateral side? Can anybody list out? You can unmute and talk. Anyone? From the lateral to the psoas major, we had 4 nerves. From above downwards or from below upwards, any order. Yes, femoral nerve. Lowermost one is femoral nerve. Thickest, correct, Arun? The next one, lateral cutaneous nerve of the thigh. Very good, very good. That is also correct. The second nerve just above the femoral nerve. Then we have ilioinguinal, iliohypogastric. Very good. So all the 4 nerves which are lateral to the psoas major, you have got it right. So my third point is also done. Which is a nerve on the psoas major? On the psoas major. Genitofemoral nerve. Very correct, Saloni. Very good. Genitofemoral nerve. Then which is a nerve medial to the psoas major? Obturator. So correct. So you have got all the branches correct. So this is in nutshell. This is related to the practical you have seen. Then the point comes that each nerve, how to remember the root value. That will be, you can just go through your theory, whatever recordings, what you have, the theory class. And plus, as I told you, T12 and L1, go with the first nerve, that is iliohypogastric nerve. L1 will go with ilioinguinal nerve. Then L1 and L2 genitofemoral. L2, L3 lateral cutaneous nerve of the thigh. Then femoral and obturator will have same root value, that is L2, L3 and L4. So now when you listen to this, it might be little difficult for you, but it is very easy. These many points, if you know, that means you have understood the lumbar plexus.
That is like an entire topic covered in like half an hour. So I hope all of you understood. Um, do read, do check out the videos, dear, first. All of you. Okay,
Yeah.
ma'am, sometimes L
Yes.
also connects.
Yeah. Actually, what is happening here is that a small twig from L4 joins with L5 to form a lumbosacral trunk, which will go with the sacral plexus. So there is a connection between lumbar plexus and sacral plexus, and that connecting point or the connecting nerve is called lumbosacral trunk, and that is between L4 and L5. So L4 and L5, a small part from L4 joins with L5 to form the lumbosacral trunk, and that connects the lumbar plexus with the sacral plexus. So everything has to function as a unit, not independent. So that connection between the two plexus is by lumbosacral trunk. Is that clear?
Taba brother, are you clear with that?
Yes, yes.
So are we good to move forward? Okay. I can see a couple of thumbs up coming. I assume that things with lumbar plexus are fine. Okay, don't worry, don't worry. Just take a look at the video. Okay, video also, because it will really help you. Sir actually starts with that diagram showing all the, root values, and then he explains clearly with the starting itself. He explains clearly. So just take a look at those videos. All videos are like 20 to 30 minutes. It just takes 15 minutes of yours if you're watching in 1.5 or 2x, which is like a normal tendency of students to watch. So just take a look at that and come, because see, some topics are going to be easy. When you learn it through these practical videos, you can easily understand, but these are kind of more theory oriented. So if you actually take a look at the textbook or the videos, whichever is there with you, if you can take a look at that and come, it will really make a good value for you by attending these sessions. So keep a note on that. So with that, I think we'll move on to the second video of the session. So the second video, we will be having a look into the like, it's just kind of an introduction to the male reproductive system. And we will start off with I think, ma'am, it's spermatic cord, right? A
Yes,
detailed
yes.
analysis of
Spermatic cord.
spermatic
Yes.
cord will be discussed. So I think we can move on to that video. And I request my technical host to play the second video of the day.
Hello students, today let us see the parts of male reproductive system. So you can see here, this is the penis, the scrotum, and inside the scrotum you can see the testis suspended by the spermatic cord. So what are the parts of the male reproductive system? The first one, this is a penis, this is the scrotum, the layer of the scrotum is opened here, and inside the scrotal sac you can see the testis suspended with a cord-like structure here called as spermatic cord. This is the spermatic cord what I am holding now, and in the bottom of the scrotum this is the testis. Now coming to the spermatic cord, this is a spermatic cord, and this spermatic cord will have 3 coverings. So how many coverings it has got? It has 3 coverings. Now this outermost layer, you can see here what I am holding now, this outermost layer is called as external spermatic fascia. So this first outermost covering of the spermatic cord is called external spermatic fascia. Once we remove the external spermatic fascia, you can make out there are some muscle fibers here. These muscle fibers are called cremasteric muscle, and the layer covering the spermatic cord is called cremasteric fascia. So the first covering is called as the external spermatic fascia, and the second covering of the spermatic cord is cremasteric fascia. I remove the cremasteric fascia also. We get to see the third covering and the innermost covering. This is internal spermatic fascia. So the spermatic cord has got 3 coverings from outside to inside. The outer one is external spermatic fascia. The middle layer is cremasteric fascia, and the inner covering is internal spermatic fascia. Now, once I remove all the coverings, we can see the contents. You can make out here, these are all the contents of the spermatic cord, and clearly we can see what I'm holding now. It is easily felt. You can make out here, we can feel it, a cord-like structure. This is ductus deferens or vas deferens. So, the first content of the spermatic cord is vas deferens or ductus deferens. Surrounding the vas deferens, you can see lot of veins here. These are all the veins. We put together, call it as pampniform plexus of veins. So, I repeat, what is this content here? What is this? This is vas deferens, which is surrounded by a bunch of veins called pampniform plexus of veins. In some individuals, these veins can become dilated or enlarged, and that clinical condition is called varicocele. So, this is whole thing put together, this is called spermatic cord. The spermatic cord has got 3 coverings. I already told you what are the coverings of the spermatic cord. From outside to inside, you have the external spermatic fascia, you have the internal spermatic fascia, and in between the two we have a muscle there, that is cremasteric muscle, and the fascia along with that is called cremasteric fascia. Then we have the contents. The first and very important content of the spermatic cord is vas deferens or ductus deferens. How to identify it in dissection? When you feel it, it will be very thick because the lumen is very small. It is very thick. So, this is the vas deferens. Surrounding the vas deferens, you can see bunch of veins called pampniform plexus of veins. There are other contents also, but they are very, very small. Like 3 arteries are present, that is testicular artery, the cremasteric artery, and artery to the ductus deferens. So, compared to these 2 structures, the arteries have very small. So, what is this content here? This is the ductus deferens. And what are these veins called? Pampniform plexus of veins. To summarize, this is the spermatic cord which is suspending the testis in the scrotum. The spermatic cord will have 3 coverings and contents. The 3 coverings are external spermatic fascia, then cremasteric fascia, and the innermost layer is called internal spermatic fascia. So, totally there are 3 coverings for the spermatic cord: external spermatic fascia, cremasteric fascia, and internal spermatic fascia. Once it is removed, we can see the contents of the spermatic cord. Those are ductus deferens, very important one. This is ductus deferens or vas deferens. Along with that, we see some bunch of veins here called pampniform plexus of veins. There are 3 more arteries which are very minute or small compared to these. Those arteries are testicular artery, cremasteric artery, and artery to ductus deferens.
Thank you so much for playing the video for us. An elaborate session on one of the most important structures. I think they would have had a doubt when they were learning inguinal canal itself on how this thing would become as a question. So over to Meera ma'am. Ma'am, you can just have a discussion with the students.
Yes. So we were talking about the male reproductive organs there. You had seen the penis, the scrotum. Inside the scrotum, you have seen the testis. And the testis is suspended by the cord-like structure. That is the spermatic cord. So spermatic cord is important because we have a lot of contents inside that and there are coverings for that. So what were the 3 coverings of the spermatic cord? There were 3 coverings, right? From outside to inside. The outermost covering was called external spermatic fascia. So what is it derived from external spermatic fascia? What is it a continuation of? Just guess. Very good. External oblique. Saloni. Very good. It's a continuation of external oblique. So the first covering of the spermatic cord is external spermatic fascia, which is nothing but it's a continuation of your external oblique muscle. Then what is the next covering? The second, the middle one. Cremasteric fascia. What is it a continuation of, or it is derived from which layer of abdomen? Cremasteric fascia. Internal oblique. Very correct. Internal oblique. The cremasteric muscle is also a part of internal oblique. So the second layer, the cremasteric fascia, is derived from internal oblique. The third and the innermost covering is internal spermatic fascia, and it is derived from, very good Saloni, fascia transversalis. So very important. You know the three names of the three coverings? Not enough. You have to know what is it derived from. Where is this covering coming from? So that is the first point. So spermatic cord is about 7.5 centimeters long from deep inguinal ring to the superficial inguinal ring. That means entire inguinal canal, you have the spermatic cord as a content. Once you know these 2 points, you will just talk about the coverings. There are 3 coverings: external spermatic fascia derived from external oblique, cremasteric fascia derived from internal oblique, and internal spermatic fascia derived from fascia transversalis. So this is how the coverings are. Now let us go to the contents. What are the contents of spermatic cord? What is the most important content? Yes, ductus deferens or vas deferens. Very important. Clinically, they do vasectomy, right? So vasectomy, where you have to take the spermatic cord, separate the contents, and you will have to identify the ductus deferens. You have to ligate it. So it is a procedure done, right? It's a surgical procedure done. You might have heard something called vasectomy. So that is where the identification becomes important. That's why I told you it will be very thick, cord-like, because the lumen is very small for ductus deferens. So very important content of spermatic cord is ductus deferens. Any other? Second important, pampniform plexus of veins. This is the correct one. Pampniform plexus of veins. There are a bunch of veins. They're called pampniform plexus of veins. What is the function of these veins? Pampniform plexus, any idea? Drain venous blood. Okay, better. What else? What other important function? Why the scrotal temperature is lower compared to the abdominal temperature? That's how the spermatogenesis can happen, right? Yes, very good, Saloni. That means this acts like, the pampniform plexus will act like a heat exchange. It will reduce the heat of the scrotum because it's like a counter current heat exchange. So pampniform plexus is very important. It is reducing the temperature of the scrotum so that spermatogenesis can happen. If the spermatogenesis does not happen, what will happen? When the counts are low, the male patient will be infertile, right? Yes or no? So the main function of the pampniform plexus is to reduce the temperature. So what will happen? Does these veins get enlarged or tortuous like varicose veins of our leg? Can it get enlarged? Yes, it can get enlarged. And what is that condition called? What do we call that? Varicocele. Very good. So the abnormal enlargement or tortuosity of the pampniform plexus is called varicocele. Very good. Varicocele. So that means the scrotal temperature will increase and this will affect the spermatogenesis. So that's why pampniform plexus is also very important clinically. Then we have other arteries. What are the other arteries of the spermatic cord? There are 3 arteries, right? Which are those? Testicular artery, correct? Cremasteric artery, okay. Artery to our important content of the spermatic cord. Yes, artery to ductus deferens or artery to vas deferens. Very correct. So these are all the contents of spermatic cord. So in our practical exams also, that will be asked. Even in spotters, it will be asked spermatic cord. Even theoretically also, the spermatic cord is very, very important. Is that clear now about spermatic cord?
Okay, I think it's clear to most of them. So, ma'am, I'd just like to ask them few questions because
Yes.
uh, these topics are being covered from our end. Students, I would like to know, is abdomen covered in your respective colleges? Like I'm asking about that particular topics, like male reproductive system. Is it covered or yet to be covered? Okay, it's not covered. Okay, okay. So, any idea when is it expected to happen? Okay, for Anjali, it's covered. Okay, no worries. So, let me ask you one more question. Let us be, okay, next few days it's going to happen. Okay, okay. June. So it's going to be different for different students. Okay. I'll ask you one more question. Be very sincere in answering this question to us. Okay. Me and Meera ma'am are like, sincerely looking forward for an answer. How many of you actually had a look at the topics of this week? Like, for example, now lumbar plexus we saw. How many of you did see the video from Polaris app? Or even the second one, which is spermatic cord. How many of you actually uh, got a chance to see? It's okay. Even if you have not seen, it's okay. We are actually trying to help you. Sorry, today is my first class. Don't worry, Pavan. Don't worry, don't worry. Anyone else? Okay, I had seen the video from a different platform. Okay, okay. Anybody else who has taken a second to revise it? Okay, Karunamai has seen the videos. Okay. Okay. Ma'am, can we just try something? Okay, I have one more. For me too, it's first class. Okay. Ma'am, can we just try something with them? Like, can we just give them a day? Because the next
Yes.
two topics which we have is testes and penis.
Yes. Yes.
Can we just give them a day so that they watch the video from the app and come? And can we just gather on Friday so that they will also? I will tell you. I will tell you. I will tell you, dear. So, you guys also just take a look at the theory videos and come, and then try to see the practical videos. So let us see how it is going to, make the experience much better. Anyway, we have joined in for a marathon. So we'll just try out this trial and error methods, because how it's going to help you better. Basically, what I am trying to do here is I am trying to bring few techniques and few, tricks, that all those things, so that your learning experience will be easy and it will be something which you can recollect about. Okay, so what we will do is today evening and tomorrow one day you will have all of you students go watch the videos in Dr. Polaris app in two topics. One topic is testis, another topic is penis. Okay, the two topics I'll repeat again. One topic is testis and the next topic is penis. Testis and penis. Go watch these videos and we will gather on Friday 6:30. Is Friday okay for all of you? We will just try out and see how learning that way happens. Is everybody with me in this? Can we all do this? Let us all try together so that we all help each other. Like you guys also will know how the learning experience is going to be better. I think we can try that out and see, ma'am, how they will come out.
Yes, yes, because once they go through, they also will have so much of doubts. So we can
Correct.
have a very interactive class. And even though if your abdomen is not started, when you sit in the class, you already have your base. So this is how it should go on. So don't
Yes,
bother, it is
exactly.
not happening in the class and everything. Once you have learned from here, you are sitting there with some knowledge. You already know it. So it's like an extra learning or revision for you. So we have to make it very interactive. We should have lot of questions so we can more explore things more, know more about the applied anatomy and everything. Is that
Okay.
okay for everyone?
Yes. So I think most of them are agreeing to me. Let us try out this way, guys, because I truly feel this is going to help you guys, this way of learning. So you first go watch the video. We'll go it in a systematic pattern. Go watch the video, find out how things are happening in the theory side. come back, sit with ma'am, have a very well discussion, watch the videos which we have prepared for you. I think penis and all is not a dissection even for them, but I think ma'am has taken extra effort to take out a specimen where complete dissection of penis is also kept ready with us. So just take a look at the videos and come back to us on Friday 6:30. We will be sending you the details of all these things. We'll be sending you, and come back at 6:30. We will have a discussion, ask all your doubts. Is that fine, everybody? Are all of you with me? Thumbs up, thumbs up, reactions. Okay, okay. Yes. So don't forget the 2 topics. I've just asked for 2 topics for Friday. One is testis and one is penis. So I think then any other queries or any other doubts you have, you can ask ma'am. You can ask ma'am about something else you want to know about her other than the routine. Any question, guys?
They are thinking.
They are thinking. They only have doubts in anatomy.
At least they are so interactive. They want to learn.
Okay, for neuroanatomy, your suggestion to be prepared. Arun, can you just clarify that question? How to prepare for neuroanatomy? Okay, is neuroanatomy started for you? Okay, don't worry. See, neuroanatomy, I don't know, I'll talk as a student. It was something which was very difficult to imagine. Out of whatever you learn in anatomy, everything you will understand when you see the specimen. But neuroanatomy was something which was even difficult to understand even after seeing the specimens. What I would say is, please give your time to learn that particular area in anatomy, because it is one of the most beautiful area in anatomy I have felt. A lot of things which comes out with a lot of reasoning, concepts and understanding, but it will take its own sweet time to get into our head. So don't worry, Arun, it is going to be like that. It's not going to be an easy thing. We will hold on with this video test until I say, can we hold on? Yeah, sure. So don't worry about that. It is going to take its sweet time. Just keep consistent. Ma'am, what do you say for Arun's doubt?
Yes. Because in anatomy is like a subject where you should not be by hearting anything. It's like you have to understand. You have to see the structures and learn. So then you will have that interest and you will never forget. It's a volatile subject. So the minute you start by hearting, it becomes difficult. Otherwise, things are easy. So we have to, as Dr. Aishwarya told, we have to be consistent in our learning, and that is our foundation.
Don't worry, Arun. It is going to be fine with you. No worry. Ma'am, memorizing is difficult in anatomy. Anjali, why do you have to actually memorize such a subject with a lot of concepts? Okay, I'll ask you a question. Is testis an internal genitalia or an external genitalia? How many of you know the answer for this? Tell me if testis is an internal genital organ or an external genital organ. It's an internal genital organ. Karnamai says. Okay, Arun says it's an external. Okay. Tababrata says external. Okay. Now, I would like to know, Arun, why did you say it is external? Pavan is also saying external. Those who said external, I would like to know, why is it external for you? Why do you think that it is external? It's okay. You will make mistakes. This is how we learn. You don't know how many dumb questions I used to ask my professor when I was in first year. It's okay, man. Come on, answer. Or if anybody can tell me, whoever has answered internal, why do you feel? Yes, I have got one answer from Karnamai based on embryological. Saloni says internal genital because of sperm production. So, ma'am, can you just explain that beautiful concept of why testis is an internal genitalia?
Is it internal or external? That is the first thing, right? So developmentally, you all know that it is internal. and later it descends, right? It descends to the scrotum. So there is a reason why it is descending and coming to the scrotum. As we mentioned there, it was because of the increased temperature. So it was internal, yes, it was internal in the posterior abdominal wall, embryologically, and it starts descending 7th month, 8th month, 9th month. By birth, in a male fetus, it should be in the scrotum. So testis has to descend because of the increased temperature. Okay, so for the sperm production, it has to descend to the scrotum.
See, guys, everything in anatomy has a very solid reason.
Yes.
Everything is conceptualized. Basically, because we are running a race, we do not have the time, or we do not have that much of patience to visualize these concepts. That is the reason why we end up in, not understanding the concepts, and we end up in memorizing. I truly understand there are a lot of things that you have to do in this first year. So many things will be there. It is difficult to tell you, sit down, understand the concepts and learn. But I am telling you, it will be useful for you in your future if you just try to conceptualize the subject. One of our tutors, Dr. Sanjit sir, says it's all about imagining. It's all about understanding why each organ is like that, why each organ is that shape, why each organ is placed here, why each organ is not coming down. So everything has a purpose, has a concept involved in it. Just understand it. But
yeah, that is what, Aishwarya. If you remember our school days, all of us have gone through the school days, right? We learn whatever our teacher tells us, right? That time we will not think, why are we learning that? But as adults, we need to always know, why are we learning it? Why is
correct.
a very important question. So once we know, yes, I'm learning spermatic cord because in vasectomy, I need to identify the ductus difference. I need to know what is varicocele. Once I know why I'm learning it, I will learn it much better. So
Correct.
why is a very important question in anatomy.
So memorizing is not an ideal way, I would say, Anjali, because out of all the love to you, I'm saying it's not an ideal way to learn anatomy, especially for the subject of anatomy, because it is going to be very important throughout your medical career. So just don't try memorizing. Try to understand at least few things. Once you start understanding it, it is going to be there in your brains. And again, I'm telling, consistency is the key. You keep doing it, make a habit. Studies should be a habit, then it will be like, you'll not forget it. Don't worry on that.
So we will help
Last,
them not to memorize, Aishwarya.
yeah,
We,
understood.
will,
Do
we are
that.
going to help them how to learn.
Correct. Okay, someone is asking about perineal body. Don't worry, Saloni. We are coming to all those things next week. I think we have peritoneum, stomach canal in our session. So after that, when we come down to pelvis, we will discuss about all these things. Don't worry about that. We are going to get back to all those topics of your query. And yeah, I think so. Do you want to see testis video and go and learn, or you are going to learn the video and come back for a testis and penis video? What do you want? You will learn and come back. Okay. So we are waiting for you guys. We will be covering these two topics. Very good. I love the spirit. Exactly what I wanted from all of you guys. Good one. That is how it comes out. That is how you will end up in understanding and learning. Don't worry. We are there with you. Just take a look at these two videos in our platform. One is testis and one is penis. And come back on Friday and see how the discussion is going to be really fruitful. I'm sure if you watch that video and come, it's going to be perfect for you. Okay, so let's take that on a stall. And ma'am, can we conclude today's session then?
Yes. So it was
Yes.
they were all very good, interactive.
Yes,
So
they
thank
answered.
you.
I think every questions, almost every questions they answered. I'm really happy in the way they are
Yes.
answering. Okay, Pawan wants to know in which college you're working. She's working in one of private medical colleges in Mangalore. So we are here in Mangalore, Karnataka. So Don't worry, reach out to us if you want to talk to her personally. So any other things? Any queries? They are shedding a lot of hearts for you, ma'am.
Thank you. Thank you.
Okay, so I'll just wind up the session for the day. Thank you, our technical host, for making sure everything was on time and the videos were clear enough without any technical glitches. Thank you so much, ma'am. We are sitting down
Thank you.
on Fridays with them for the
Yes.
learned discussion of both the topics, both testes and penis. So until then, it's bye from both of us. Thank you so much.
Thank you.